Welcome. This is the Dentist News Network. I'm Scott Drake. Today, my guest is Dr. Lewis Robinson with Periodontal Specialists in Scottsdale, Arizona. Dr. Robinson, it's good to meet you. Thanks for joining us.
Thank you.
So we hear a lot of advertisements, especially recently, on same-day dental implants. Is that really possible?
It is actually. It's pretty remarkable technology. Historically, the paradigm for dental implant placement was to place an implant, or a fixture as it's called in our profession. We would wait then 3 to 6 months, and then we would come back in and do the restorative treatment phase, which means we would make the tooth that fits on top of the dental implant. Today, because of new technological design changes, new surface materials, and also the method for placement, we're able to place implants at more increased force torque, allowing great stabilization, so that dental implants can be installed and the tooth can be made in the same day. It works particularly well for patients who have no teeth, what we call the edentulous patient. Patients who wear dentures, for example, they can come into the office, have a grouping of implants, usually 4 in a specific array, and they can have a permanently fixed attached denture made that bolts onto the implants, screws into the implants, and they leave my office after surgery with teeth attached to their mouth. It's pretty remarkable.
Dr. Robinson, can you talk a little bit about the aesthetics and the overall functionality? Do these new implants perform the same way as the old ones?
The old dental implants gave us one really very important principle, and that was that these metal objects could be screwed into the patient's jawbone, and they would become, the term's called integrated, they would become fused to the bone, and they would be very strong and very stable, and then we could attach various types of dental appliances, either removable prosthetics or individual teeth, to those implants. But they were not very aesthetic. They were primitive by today's design standards, and so today patients really want to have teeth that look like teeth, and that means they want implants to be designed in a way that nobody could ever tell that they have a dental implant. They want an implant to be natural in its appearance and in its function. And so there is a whole array available today of different types of components that can be used to maximize aesthetics. We use ceramic materials such as zirconia, which women would know that zirconium is a substitute for diamonds, but it's a very hard mineral, and it can be made as a porcelain product. So when we use it, it's natural tooth colored. It can be shaped exactly like a tooth. Porcelain restorations such as crowns can be attached to those ceramic components, and I would defy anybody, even dentists, to look in somebody's mouth and tell where the implant is. It's profoundly accurate.
Dr. Robinson, it's been a pleasure. Thank you.
Thanks.
My guest has been Dr. Lewis Robinson with Periodontal Specialists in Scottsdale, Arizona, and this is the Dentist News Network.